Hi, this is Mark Struthers. Today we're going to take a look at the two different models of being a radiologist, one as an employee and the other as a contracted service provider. Prior to becoming an attending radiologist or a member of the American Board of Radiology, the radiologist must have an extensive background not only educationally but experience. Let's take a look at the roadmap. After getting your undergraduate degree, you will go to medical school, either MD or DO. Here in medical school, you will become a physician, and later on, you'll do a one-year internship followed by 4 years of diagnostic radiology residency and 1 or 2 years of a subspecialty fellowship.
Today we are going to explore the differences of medical imaging services provided by contracting with a radiology service or directly employing physicians that are radiologists to meet the needs of the hospital or medical facility. The integration of radiologists into hospital staff has become a significant topic of discussion in the healthcare sector. Their expertise is essential for accurate medical imaging diagnosis, which can lead to timely and effective treatment. However, the decision to integrate radiologists into hospital staff raises various pros and cons that need to be carefully considered. One of the primary advantages of integrating radiologists into hospital staff is the enhancement of collaboration among healthcare professionals. When radiologists are part of the hospital team, they can work closely with other physicians, nurses, and specialists. This collaboration fosters better communication, leading to more accurate diagnoses and treatment plans. Additionally, having radiologists on site allows for immediate consultations, which can be critical in emergency situations. This synergy not only improves patient care but also enhances the overall efficiency of the healthcare system. Integrating radiologists into hospital staff can significantly improve patient care. With radiologists readily available, patients can receive quicker diagnoses and treatment recommendations. This immediacy can be particularly beneficial in cases where time is of the essence, such as in trauma or acute illness scenarios. Furthermore, having radiologists as part of the hospital team allows for a more holistic approach to patient care, where imaging results can be discussed in real time, leading to more informed decision-making and better outcomes for patients. Another advantage of having radiologists integrated into hospital staff is the streamlining of processes. When radiologists are part of the hospital, the workflow for imaging studies becomes more efficient. Orders for imaging can be placed and processed more quickly, reducing wait times for patients. Additionally, the integration can lead to improved protocols for handling imaging results, ensuring that critical findings are communicated promptly to the relevant healthcare providers. This efficiency not only enhances patient satisfaction but also optimizes the use of hospital resources. Despite the benefits, there are also drawbacks to integrating radiologists into hospital staff. One significant concern is the potential increase in costs. Employing radiologists as part of the hospital staff can lead to higher operational expenses, which may be passed on to patients or insurance providers. This financial burden can be a deterrent for some hospitals, particularly smaller facilities with limited budgets. Additionally, the costs associated with maintaining advanced imaging technology and facilities can further strain hospital resources. Another con of integrating radiologists into hospital staff is the potential for role confusion among healthcare professionals. With radiologists taking on a more prominent role within the hospital, there may be overlaps in responsibilities with other specialists. This can lead to misunderstandings regarding who is responsible for certain aspects of patient care, potentially impacting the quality of service provided. Clear delineation of roles and responsibilities is essential to mitigate this issue and ensure that all team members work effectively together. Resistance to change is a common challenge faced when integrating radiologists into hospital staff. Many healthcare professionals may be accustomed to traditional workflows and may be hesitant to adapt to new systems and processes. This resistance can hinder the successful implementation of integration efforts, leading to frustration among staff and potentially impacting patient care. It is crucial for hospital leadership to address these concerns through effective communication and training to facilitate a smoother transition. Balancing the pros and cons of integrating radiologists into hospital staff requires careful consideration and strategic planning. Hospitals must weigh the benefits of enhanced collaboration, improved patient care, and streamlined processes against the potential drawbacks of increased costs, role confusion, and resistance to change. Engaging stakeholders in the decision-making process can help identify the best approach to integration, ensuring that the needs of both patients and healthcare providers are met. The future of radiologists in hospitals is likely to evolve as healthcare continues to advance. With the increasing reliance on technology and data analytics, radiologists may find themselves taking on new roles that extend beyond traditional imaging. As integrated care models become more prevalent, radiologists will need to adapt to these changes, embracing collaboration and innovation. The ongoing development of telemedicine and remote imaging services may also influence how radiologists operate within hospital settings, offering new opportunities for patient care. In the healthcare landscape, the contracting of radiologists versus radiology services presents a complex decision for hospitals. Understanding the nuances of these two approaches is essential for stakeholders. Hospitals must consider not only the financial implications but also the quality of care and operational efficiency. This decision impacts various parties, including hospital administration, radiologists, and patients. By examining who benefits most from each contracting model, we can gain insights into the broader implications for healthcare delivery. Contracting radiologists directly can offer hospitals several advantages. First, it allows for greater control over the quality of care provided. Hospitals can select radiologists based on their expertise and experience, ensuring that patients receive the best possible diagnostic services. Additionally, direct contracts can foster stronger relationships between radiologists and hospital staff, leading to improved communication and collaboration. This model can also enhance accountability, as radiologists are directly tied to the hospital's performance metrics. Ultimately, this approach can lead to better patient outcomes and satisfaction. On the other hand, contracting radiology services can provide hospitals with flexibility and cost-effectiveness. By outsourcing radiology services, hospitals can reduce overhead costs associated with hiring full-time radiologists. This model allows hospitals to access a broader range of specialists without the commitment of permanent employment. Furthermore, radiology service providers often have established networks and resources that can enhance service delivery. This can be particularly beneficial in rural or underserved areas where access to specialized care is limited. The choice between contracting radiologists and radiology services significantly impacts hospital administration. When hospitals contract radiologists, they may face higher upfront costs but can benefit from improved patient care and satisfaction. Conversely, contracting radiology services may lead to lower operational costs but could compromise the quality of care if not managed properly. Hospital administrators must weigh these factors carefully, considering their institution's specific needs and patient demographics. Ultimately, the decision should align with the hospital's strategic goals and mission. Radiologists themselves are also affected by the contracting model chosen by hospitals. Those contracted directly may enjoy job security in a more stable work environment, fostering professional growth and development. However, they may also face increased pressure to meet performance metrics and patient demands. In contrast, radiologists working for service providers may benefit from a more flexible work schedule and the opportunity to work in various settings. However, they might experience less job security and fewer opportunities for professional advancement. Patient experience and outcomes are critical considerations in the contracting decision. When hospitals contract radiologists directly, patients may benefit from more personalized care and better communication with their healthcare providers. This can lead to improved trust and satisfaction. Conversely, when radiology services are contracted, patients may experience delays in care or less continuity, which can negatively impact their overall experience. Hospitals must prioritize patient-centered care in their contracting decisions to ensure that quality is not compromised. Financial implications play a significant role in the decision-making process for hospitals. Contracting radiologists may involve higher costs due to salaries and benefits, but it can lead to increased revenue through improved patient care and satisfaction. On the other hand, contracting radiology services can reduce costs and provide financial flexibility, but hospitals must be cautious of potential hidden costs associated with outsourcing. A thorough financial analysis is essential to determine the most sustainable option for the hospital's long-term viability. Regulatory and compliance considerations are paramount in the healthcare industry. Hospitals must ensure that whichever contracting model they choose adheres to legal and ethical standards. Contracting radiologists directly may simplify compliance, as hospitals have more control over their practices. However, when outsourcing radiology services, hospitals must ensure that service providers meet all regulatory requirements. This includes maintaining patient privacy and adhering to billing practices. A robust compliance framework is essential to mitigate risks associated with either contracting model. As the healthcare landscape continues to evolve, so too will the trends in radiology contracting. The rise of telemedicine and advancements in technology may influence how hospitals approach contracting. For instance, teleradiology services could offer hospitals a hybrid model that combines the benefits of both contracting radiologists and radiology services. Additionally, as value-based care becomes more prevalent, hospitals may need to reassess their contracting strategies to align with new reimbursement models. Staying ahead of these trends will be crucial for hospitals aiming to provide high-quality care. The field of radiology, stress is an ever-present challenge, particularly for hospital-based radiologists. These professionals often face high-pressure environments, where the demand for quick and accurate diagnoses can lead to significant mental and emotional strain. The nature of their work requires not only technical expertise but also the ability to manage time effectively while dealing with complex cases. This stress can be exacerbated by the need to collaborate with other medical staff, navigate hospital bureaucracy, and meet the expectations of patients and their families. Understanding the sources of this stress is crucial for developing effective coping strategies. Hospital-based radiologists play a vital role in patient care, providing essential imaging services that inform treatment decisions. They are often on the front lines of diagnosing conditions, which can range from routine screenings to critical emergencies. This responsibility can create a heavy burden, as the consequences of misdiagnosis can be severe. Additionally, the need for continuous education and staying updated with technological advancements adds another layer of pressure. The combination of these factors contributes to a high-stress work environment that can impact both personal well-being and professional performance. In contrast to hospital-based radiologists, contracting radiology services offers a different approach to delivering imaging care. Contracted radiologists often work remotely, providing interpretations of images from various locations. This model can alleviate some of the stress associated with hospital employment, as it allows for greater flexibility in work hours and environments. However, it also presents its own challenges, such as the need for effective communication with hospital staff and potential feelings of isolation. Understanding the pros and cons of this model is essential for hospitals considering outsourcing their radiology services. When comparing the stress levels of hospital-based radiologists to those of contracted radiologists, several factors come into play. Hospital-based radiologists often experience immediate pressures from their work environment, including the need to respond quickly to urgent cases. In contrast, contracted radiologists may face stress related to meeting deadlines and maintaining quality standards without the support of a hospital team. Studies have shown that while both groups experience stress, the sources and manifestations of that stress can differ significantly. This understanding can help in tailoring support systems for each group. The impact of stress on mental health is a critical concern for radiologists, regardless of their employment model. Chronic stress can lead to burnout, anxiety, and depression, which can affect job performance and personal life. Hospital-based radiologists may find it challenging to disconnect from work due to the demanding nature of their roles, while contracted radiologists might struggle with feelings of disconnection from their colleagues. Addressing mental health issues in both settings is essential for fostering a healthier work environment and ensuring the well-being of radiologists. For hospital-based radiologists, developing effective coping strategies is crucial in managing stress. Techniques such as mindfulness, time management, and seeking support from colleagues can help mitigate the pressures of the job. Additionally, hospitals can play a role by providing resources such as counseling services and stress management workshops. Encouraging open communication about stress and mental health can create a supportive culture that empowers radiologists to seek help when needed. Implementing these strategies can lead to improved job satisfaction and overall well-being. Contracted radiologists can also benefit from specific coping strategies tailored to their unique work environment. Establishing a routine that includes regular breaks and time for self-care can help manage stress levels. Networking with other radiologists, whether through professional organizations or online forums, can provide a sense of community and support. Additionally, utilizing technology to streamline workflows and enhance communication with hospitals can reduce feelings of isolation and improve job satisfaction. By prioritizing mental health, contracted radiologists can maintain a balanced and fulfilling career. Technology plays a significant role in both hospital-based and contracted radiology practices, impacting stress levels in various ways. Advanced imaging software and telemedicine platforms can enhance efficiency and reduce the workload on radiologists. However, the constant evolution of technology can also create pressure to stay updated and proficient. Embracing technology as a tool for stress management, rather than a source of stress, is essential. Training programs that focus on the effective use of technology can empower radiologists to leverage these tools to their advantage. Organizational support is vital in addressing the stress experienced by radiologists. Hospitals and contracting agencies should prioritize the mental health of their staff by providing access to resources such as counseling, stress management programs, and wellness initiatives. Creating a culture that values mental health can lead to increased job satisfaction and retention rates. Additionally, regular assessments of workload and staffing levels can help identify areas where support is needed, ensuring that radiologists are not overwhelmed by their responsibilities. Achieving a healthy work-life balance is crucial for radiologists to manage stress effectively. For hospital-based radiologists, this may involve setting boundaries around work hours and making time for personal activities. Contracted radiologists can benefit from the flexibility of their roles, allowing them to create a schedule that accommodates both work and personal life. Encouraging radiologists to prioritize self-care and family time can lead to improved mental health and job satisfaction. Organizations should promote policies that support work-life balance, recognizing its importance in reducing stress.
This is Mark Struthers. Thank you for your time, and please subscribe to the channel, and we have a number of videos for medical imaging and radiology for you to view.